1 year ago, Beth Turner's life was turned upside down. Doctors found an abnormal growth on her lung and diagnosed her with empyema, a respiratory disease. Beth has to pay for the oxygen concentrator, tanks and other related expenses. Her government-funded Medicare insurance isn't nearly enough, and she only gets $1,000 a month from welfare benefits. It's another health burden she carries. Beth's 14-year-old son is mentally ill.
I feel like a failure as a mother. My son has certain needs that I just can't meet. And I don't qualify for anything from downtown. I get $16 a month in food stamps.
But now that the Supreme Court has upheld President Obama's health care law, Beth can get private insurance, even with her pre-existing condition. The Community Health Centre in Buffalo sees up to 300 patients a day. Most have Medicaid, government-sponsored health program which covers primary care. But only 15% have private health insurance. The centre is forced to write off about $250,000 a year in costs, or a third of its fees, because of those patients who either don't have insurance or can only partially pay their bills. Medical staff say Obama's health plan will make a huge difference.
This is going to be a paradigm shift for all those people that say, I've been sick for a while, I don't go to the doctors because I can't afford it. They can now afford it.
There's one group of people here that is particularly happy about the Supreme Court decision. There are around 25,000 immigrants in Buffalo who now qualify for health insurance.
How are we doing today? Fine?
Good. Abdurrahman Farah works with the local immigrant community. He sees patients every day from developing countries with conditions that have gone untreated for years. But Farah predicts the ruling will bring them new hope.
When they come here, they struggle. They come here and work. Some of them work, but they have insurance, and they have families to feed for, so they try and make ends meet.
It may take a while for the effects of Thursday's verdict to hit home and make a real difference. So you think Obama did the right thing by putting this legislation out there?
I do. I really do. It's about time.
But for patients like Beth, it will be well worth the wait. Cath, Al-Jazeera, Buffalo, New York.